restrictions coming into force. Many shops will reopen, many for the first time this morning in almost 3 months. We'll be able to travel within our county and meet small numbers of family and friends at home or outside. But social distancing of 2 metres remains in force, as does the 15-day self-isolation for those arriving in the country or indeed returning here from abroad. We're joined here in the studio by Minister for Health, Simon Harris. Minister, you're very welcome to the programme.
Good morning, Brian. Thank you.
You've described the progress so far in confronting the pandemic as fragile. What are you saying today to people about their own behaviour as we embark now on this next phase of reopening the country?
Brian, I think this is a great day for our country. I think it's a day of hope. It's a day that we weren't guaranteed to get to. There'll be grannies and granddads waking up this morning wondering can they see their grandkids today, or if not, by the end of the month. There'll be people waking up this morning going back to work who weren't sure whether their job would come back. It is a really good day. People have brought us to this point. They've made huge progress. But what I am saying to people is this. I want the good day to become a good week, a good month, a good year. I want us to keep going forward. And to do that, the issue of our own personal behaviour now becomes more important than ever. So just a few quick kind of tips I'd give people as they go about their day. We can now meet up with a few people, 6 people indoors, 6 people outdoors. The key though is to still keep our close contacts small. So don't meet up with, one group of people in the morning and a different group in the afternoon and another in the evening. Decide who are the couple of people that I'm missing. My mom, my dad, my brother, my sister, the neighbour down the road who comes in for a cup of tea, and make those arrangements. Keep a list of the close contacts that you are meeting. Jot them down somewhere so that if there is a case, we can quickly contact trace. Make sure when you do meet up, you keep those 2 metres. Keep that physical distance, that's really important. Remember, meeting up outdoors is still better than meeting up indoors. And then another important point I'd say is just on the issue of face coverings now. As more and more of us start to move around again, remember the public health advice when you're on public transport or in a supermarket or a shop is you should wear a face covering. These are just some of the things, along with hand washing, that all of us can do to make sure this phase is a success. Because if we get through this phase, we're going to be in a very good place. If we don't, we're going to find ourselves stuck.
Are you saying to people that they should feel obliged to wear a face covering if they're in those sort of settings?
So I am conscious that we don't want to stigmatise those who can't. So the guidance is people under the age of 13, children under the age of 13 shouldn't, and there'll be some people for medical reasons who can't. But for the rest of us who can, my strong advice is to do so. It is an additional hygiene measure. It's not a magic shield. It doesn't stop you getting the virus, but it can help stop the spread of droplets from you to another person. So yes, you should wear one.
Just a word about measuring progress.
Yes.
In terms of getting us to this point and hopefully to the next stage as well. Things like hospitalisations, the numbers of people who admitted to ICU, the reproduction rate. What could reverse this process of progressively easing the restrictions? What could actually lead us to a situation where restrictions might have to be reimposed?
So you and I often discuss this, and I suppose I often make the point that there isn't one number. What we look at instead are a range of issues. And you're quite right to point out the OR number, the reproductive number. Once that number remains below 1, it means the virus is continuing to be suppressed. If that went above 1, we're back in a very difficult situation. We look at not just actual numbers of patients in ICU, but the trend. So thankfully the trajectory is downwards. We've the lowest number today in a very long time, 34. In terms of hospitalisations, we've hit a new low of 122 people with confirmed cases today in Irish hospitals, and 10 hospitals with no case. If you started to see a significant increase in ICU, an increase in the actual number of new cases in the OR number. If you started to see them, our public health experts would step in and advise us of measures we need to take. I should say this though, we do know more about the virus now, and we do know what measures work in terms of being able to slow down its progression.
The 2 metre rule, a report, and it's cited in the Irish Independent this morning, a report from the Department of Business is saying that sticking to this 2 metre rule for social distancing could cost thousands of jobs in the hospitality sector in particular. They put a figure on it, 85,000 jobs, and quote, render large portions of this sector unviable. Is it time to look at this rule now and consider moving to what the World Health Organization recommends, which is 1 metre?
So 2 metres is definitely safer than 1. Of that there's no doubt. Of that there's absolutely no doubt, and the World Health Organization have been clear. So I just need to be crystal clear. 2 metres is the public health advice. However, the National Public Health Emergency Team did recognise in a letter to me on Friday that there may be some settings in which the 2 metres may not be easily applied. And what they have now said they will do is they will review the application of the social distancing measure in the hospitality sector. on the condition that the prevalence of the virus remains low. So this is something that will be looked at, but it has to be looked at from a public health point of view, not from a he who shouts the loudest, because nobody wants to be the business. Nobody wants to be the business that has a cluster of COVID in their restaurant or their pub.
Well, will that review be completed in time for their reopening next week?
Yes, so my intention is that the National Public Health Emergency Team would do this work over the next kind of week to 2 weeks and provide guidance to government in that regard. businesses have been incredibly responsible here. We've got to acknowledge that. Businesses want to protect their staff. They want to protect their customers. That's good for business as well as being the right thing to do. So we do need to get this right. We need to do it, though, in a public health-led way rather than just he who shouts the loudest.
We still, though, have some of the most severe restrictions in Europe, in this country. Why is that the case? Why are we among the slowest European countries to reopen our society?
I think that question, if you don't mind me saying so, is a hard one to answer, because what looks slow today may look very prudent or sensible in 3 or 4 weeks' time. So, I remember in the past getting asked questions of, should you not bring in lockdown quicker? Why didn't you bring it in when this country did or that country did? This is a very dynamic situation. I think what we showed as a government and as a country on Friday was that we are willing to adapt as the virus trajectory changes in our country. So we brought forward a number of measures into this phase. We have public health advice now that says it is safe to maybe do our reopening plan over 4 phases rather than 5. So we'll now be looking at the remaining phases to see how best to sequence them, if you like. But we're going to make sure public health is first here, because people have come too far, sacrificed too much and made too much progress to go backwards.
But we've looked at 5 European countries which reported their first confirmed case of COVID around the same time as us, late February, early March. They are Norway, Denmark, Netherlands, Switzerland, Portugal. All of them are well ahead of Ireland in terms of opening up again.
But it's not a race, right? And indeed with this virus, it's very much a marathon. This is something that's going to be with us as a world and in our own country for many, many months. So we have to plan and proceed with caution. For example, I know in some of those countries, they've actually seen a very significant a much fewer number of cases than we have in our own country. So lots of different countries have different reasons in relation to where they're at with this virus and the measures they decide to take. We have to do what's right for our country. We have to follow our public health advice. But if I take, I think, the kernel of your question, we also have to be intelligent and smart enough to be willing to change when the evidence changes as well. And I think we showed that on Friday. On Friday, because of the work of the Irish people, it was possible to bring forward a number of measures. It now may be possible to open up more of our country in July, and the summer that we thought might be lost, we may be able to get back.
But let's take something like schools. They reopened in Switzerland, the Netherlands and Norway back on the 11th of May. They reopened in Denmark, one of the first countries in Europe, on the 15th of April. That's almost 2 months ago, and we're still waiting for them to reopen at the end of August, even though you were saying perhaps we could have them back a day a week by now.
Yeah, look, I think when we look back at this pandemic, and remember we've been learning more about the virus every day, it's still a relatively new virus. I think the whole issue of schools and children and the level of transmission amongst children will be something that people will reflect on and experts will reflect on as well.
Has it been mishandled?
No, certainly it hasn't been mishandled at all, and I don't think we should ever apologise as a country for taking a precautionary approach when it comes to our children's health. I don't think there's a parent listening to this programme who wouldn't want their government to do everything possible to protect the health and well-being of their children. But the big priority now has to be getting our kids back to school, and Joe McHugh, my colleague, is working on that. Catherine Zappone is working on reopening our creches, because there is obviously an effect and an impact on the health and well-being of children when they're out of the school system for so long.
Parents going back to work today, how are they going to manage when the creches aren't open until the end of the month?
Yeah, look, this is a real challenge, an absolute real challenge. I think there's a couple of things. Firstly, we can't open the creches until it's safe to do so. And the roadmap has determined that that is from the end of the month. And there's a huge amount of work being undertaken and led by Catherine Zappone to make that a reality, good guidance published. In relation to today, I know a number of employers will continue to be, as they have been since the start, show flexibility and common sense, staggered shifts. And I also know people will be coming to local arrangements as well. It's far from ideal. But again, we have to put the health and safety of our children first.
The hairdressers, the barbers, any chance of bringing that forward again? A lot of these countries we've been talking about, they're well open by this stage.
Well, you look much better groomed than I do, so I'm certainly very sympathetic to the idea of them opening as quickly as possible, but only when it's safe to do so. As the Taoiseach has indicated on Friday, at the moment they're in phase 4, which is opening in July. I do know, and I want to acknowledge, they're coming forward as an industry with really good, sensible suggestions as to how they want to reopen in a safe manner. And what government is now going to do over the next couple of days and weeks is engage with industry, and we're going to sequence what phase 3 and phase 4 looks like. So it's an open question.
Just a final question on government formation. Do you think this is the last time you'll be in this studio speaking to us as Minister for Health? Could we have a draft deal this week?
Well, I love being Minister for Health, so I hope not. Could we have a draft deal this week? Yes, we could. Yes, we could. There's still an awful lot of work to do, and my own party has a number of priorities that we want to see addressed. We want to obviously have an assurance in relation to income tax and USC. Now is not the time to hike taxes on workers. We need to see extra supports for business businesses in the month of July, supports for farmers. There's a number of key issues we need to see resolved. We can't sign up to an agreement for the sake of an agreement. It has to be one that works for the country. But yes, we need a new government. We need a government in place for the next 4 or 5 years that can get on with the job. Big challenges ahead, and I hope this week can see progress.
And if this week is missed, is that this particular exercise at a conclusion finished?
I'm not closely enough involved to say that, other than to point out that the Taoiseach has talked about the end of June being a hard deadline for a number of reasons. It's hard to see how you meet that deadline of the end of June if there isn't progress or an agreement this week.
Minister for Health Simon Harris, thanks for talking to us here
much
on Morning Ireland. The time 25.5 minutes past 8.
And let's talk to the Managing Director of Irish Water, Niall Gleeson, because a hosepipe ban is coming into effect across the country from tomorrow. Mr Gleeson, thanks for being with us. It means we can't use a hosepipe to fill paddling pools, to wash our cars or to water our gardens. Why the need to do this? How low are supplies?
Well, I think we all know that the last 3 months, the spring has been one of the driest on record. And the projections from Met Éireann are that the dry weather